Hello and welcome to another Conversations with CHEST Leadership. I'm Dave Schulman, CHEST President, and I'm here with Amy Morris. Dr. Morris, first of all, thanks so much for joining us this morning.
Thank you for having me.
For my benefit, as well as the benefit of those watching, tell us a little bit about your background personally, what you do at home, and then what you do at CHEST.
Okay. So I'm on faculty. I'm a pulmonary and critical care faculty at the University of Washington in Seattle, so far west. I am a little bit of a jack of all trades in my clinical work. I work at two different hospitals, ICUs, medical ICU, oncology ICU, pulmonary consults, a little bit of a clinic practice. I focus my clinical sort of academic work in point of care ultrasound. I'm the director of inpatient point of care ultrasound at the University of Washington Medical Center, where we are building infrastructure for things like documentation, QI, and billing, hopefully, as we develop our program. And so I guess that's where I spend most of my time.
At home, back at the home institution.
Back in the home.
I want to come back to
Homestead, far west Homestead.
I want to come back to. Well, actually, this is a good time. So, talk to me a little bit about the evolution of point of care ultrasound. Now, again, I'm of a certain age. I did my fellowship in the late '90s. Like that wasn't really a thing. Like when we wanted to do an ultrasound of any sort, we called radiology or emergency. Actually, emergency medicine was dabbling a little bit. This is sort of a standard skill now these days. Like what's the You were sort of involved in that sort of evolution. I mean, what's it look like from your standpoint, from the evolution of no training to actually now it's an expected skill and probably very helpful at the bedside?
Well, I think it depends on where you train. So there are some institutions where point of care ultrasound has been finely tuned in terms of education and practice for decades, and our ultrasound faculty here at CHEST represent a lot of those locations, right? And for most of us, though, I think where we trained and where we practice now, we're much earlier in the evolution towards this utopia of everyone knows how to scan and has a machine to scan, has access to that. So a slightly different perspective for me than for others, but when I started in the ultrasound space, it was out of interest and because no one else was doing it, and I thought it was cool and useful. But back then, we had little oscilloscopes, basically, right? It was this little tiny square and a big old probe, and
let me get the bedside to the table, and you brought this cart over.
Yes, you could. I think that's a vein. I think. And of course now, the technology has evolved to now we have pocket machines, which are easy to carry around on rounds. And the bedside machines are much more, they're much better than anything we saw 15 years ago. But yes, you're right. I think it is becoming standard practice, standard of care. It is standard of care for some applications of critical care medicine, and trainees are expecting it in their training programs, and I think hospitals are starting to expect it in your skill set. And at the same time, we're grappling with how to make sure that folks do it right. They're trained well, and they're doing it right. At my institution, we are in the throes of trying to go from some people know how to do it, often it's the trainees more than their faculty, to everyone has a basic skill set, the essential skill set, and then we have some advanced providers. And how do we manage that? That is a tremendous work in progress.
All technologies go through this evolution where the older faculty, again, I include myself in that subgroup, didn't train in it. The younger faculty and fellows get very good at it iteratively, and there's this weird dichotomy of the most senior people are the least competent to do this sort of evolving and potentially essential skill set. I mean, we saw it for a number of procedures. EBIS, we see it, but
and there's implications for that. There are significant implications for that, both in terms of patient safety, right, quality of care, as well as the education dynamic. And so I think all education, ultrasound efforts need to focus not just on how do you train a few people to do it, but actually how do you train the trainer and reach out for faculty development as well as your trainee education.
Faculty development's a nice segue. So your current position at CHEST is you are chairperson of the education committee, but can you talk a little bit about your travel through the different leadership positions that you've held at CHEST?
So I have I think when most people get involved in chess, they come up through the networks. It is a great way to meet people. If you're not involved in the networks already, go to the annual meeting, go to a network meeting, meet people, and they're organized by subject area, right? What do you find clinically interesting? I had a slightly different path because one of my mentors, Alex Niven, pulled me in to work on a project about 10 years ago now, at a time when chess was really trying to build its educational approach for faculty at the annual meeting in particular, where we were trying to increase the interaction, move away from the sage on the stage lecturing to the crowd approach of education, and really try to get more interactive techniques, some smaller group education, that project was so successful. We don't have that project anymore because it is a standard part of the way people teach at the chess annual meeting, as we really focus on interactive techniques, and we encourage our faculty to be very interactive and innovative. Often we try to do different things every year at the annual meeting in terms of small group education, chalk talk style education as opposed to the PowerPoint. We're always trying new things. So that was a sort of a special project within the Education Committee, and that evolved over time into different projects within the Education Committee and the subcommittee structure, which we could talk about, and until just taking over the chair position this year. So my space at Chest has always been within the Education Committee. Yeah.
So you've seen the evolution. The Education Committee, I think people think, well, chess is all about education. That's the most important committee at chess, and in many ways it is. Talk a little bit, if you could, about the current structure of the Education Committee, maybe a couple sentences on the different subcommittees, and then what does the committee do? I mean, chess is all education. Isn't it just the only committee at chess?
No, well, I wouldn't say it's the most important committee. I think all the committees are
very
important.
Political.
Yes,
For the chairperson of the committee saying, well, we're not the most, that's a very politically good thing to say.
Well, I think that, but it can be hard to understand. The chess committee structure, if you're not involved in it, can be opaque, right? And I think for even those of us who've been involved in chess for some time, sometimes have a little trouble figuring out how things are organized. So the Education Committee is really a collection of subcommittees. I would say there is a central education committee with core education committee members, which is a fairly small group actually. But what's interesting about it is the subcommittee structure, the way the Education Committee does its work, which is, I suppose, in a nutshell, to inform, oversee, and help develop educational content at chess. But the subcommittee structure is what allows that to happen. So there are several. The Live Learning Subcommittee is really focused on developing and bringing to learners the amazing hands-on education activities that we have here at Chest headquarters and also at the annual meeting, right? The simulation training, the procedural training that I don't think anyone does as well as Chest. And that's a large group of people who focuses on that. There is the Outcomes Subcommittee, which helps us as an organization and as well as the faculty of these courses understand what we're doing well and what we need to build on, and how we can iteratively change these courses over time to make them better. And same with the annual meeting. What are we doing well? What do we need to try next? Or what directions do we need to move in to make this a better experience for our learners? There is the Faculty Development Subcommittee, which is focused entirely on how do we make folks better teachers. Chest faculty, the annual meeting, learning courses here at headquarters, but also back home. How do we develop education within our faculty at Chest, but really it's exporting to the entire pulmonary, critical care, and sleep community. And that's all with an eye towards building, the next generation of providers as well as medical educators. And the Innovations Subcommittee, which is, as it sounds, about taking new ideas and being creative and developing those to make them ready for prime time, helping folks who have educational ideas bring them to fruition. And just recently, we're excited about this, the patient education is going to be an official
That's
part.
new, right?
That is new. So patient education, the Chest Foundation has done a lot of work developing patient education materials over the years, and they've put out some fantastic things, some of which folks may be using in their clinics right now. But it hasn't been a part of the education committee in the past, and we are trying to bring that in so that we are really putting all of education under one roof as best we can.
There are two related questions I get from membership. People email me or tweet at me. One is, I like ultrasound, I do a lot of ultrasound at home. How do I get involved if I want to teach ultrasound, if I want to get into that sort of cadre of folks who gets to be on the other side of the aisle for it? How does one get involved in that if they want to try to, again, competition is always challenging, right? There are a lot of really great educators at Chest. How does somebody try to dabble or get their foot in the door in the space of or at the annual meeting or some of the other meetings that we have?
Mm-hmm. So I would say that there are a few ways to go about it. The key thing is getting to meet folks who are already in that space, right? I mean, that's the beauty of the annual meeting and Chest courses is you get to meet people. We work with our colleagues. We get to expand our horizons and our networks. And so there are ultrasound courses that happen at Chest headquarters throughout the year where you will work directly with the folks who are already teaching these courses. You can learn about how that works and get to know these folks and talk with them about your own experience and what you're interested in. At the annual meeting, too, we have simulation courses throughout the duration of the meeting where you'll get to work with these folks again, get to know them, find out what the opportunities are. And I would say those are the best places to get started.
Show up, speak up.
Show up and speak up, yeah. And I think Chest is also working on some new education initiatives focused on a more bite-sized approach to education. Bite-sized crowdsourced education is a project that we're working on and hoping to launch, wherein folks can submit educational content that they have developed, starting with videos up to 10 minutes long, and share with the world the things that they're working on. So there is hands-on teaching, and then there is also didactics that are more universal that can be shared with the world through the digital space, and that's another way that we're hoping to create opportunities for folks to get involved in education at Chest.
One of the other innovative things that I've seen the Education Committee do, and I had the privilege of being part of a judging crew for it, is this fish bowl, air tank. I feel like we changed the name sometimes.
Yes, I think there were some legal concerns.
There may have been. So what's the current name of it, and can you tell us a little bit about that initiative over the last couple of years? The air tank contest that you are referring to. This was so Hans Lee and Mark Labracombe and the Education Development Subcommittee at Chest, I believe this was their brainchild. And you can watch the video on the website. It's on the website, on the Chest website. Was to essentially foster the development of creative education ideas and put some money behind it. So we had a contest where folks developed educational ideas. They pitched those ideas to a crew of sharks, minnows. I'm not sure that's the term we should use. They're definitely, I don't know what they are, but they're definitely not sharks.
We were octopi, hands in all sorts of educational pies.
The octopus pod.
The octopus pod. Orctopod. So you and I were judges on that, along with Hans, and we heard about some truly creative, fantastic educational ideas that we wanted to fund all of them, but we couldn't. And so the winning project, I don't know if I can talk about the winning project.
Well, I mean, it was available for public consumption, so it was broadcast. You can at least sort of say, here's what won, and even though we haven't seen the output of the project yet.
Yes, well, that is true. That is true. So, and it feeds into a little bit this idea of crowdsourced education, right? Trying to allow folks to participate more in educational projects. And so Bill Kelly was the winner of this year's air tank competition with an idea to essentially foster educational output by folks who have great ideas but maybe don't quite know how to go about manifesting that.
Building a structure for them to kind of put their own content in so people could develop their own educational initiatives in an easier way. It's a cool idea. We look forward to it coming to fruition. I think that's sort of all of the questions we had. Dr. Morris, thanks so much for joining us. Thanks also for the hard work. And you and I have had the pleasure of working together a number of times, Innovation Subcommittee way back in the day. But it's been incredible to watch the work you've done. Thank you so much, both in the ultrasound space and in the Education Committee leadership, and looking forward to future great things. So appreciate you joining us this morning.
Thank you for having me.